Thank you so much for being here, Valerie.
Well, thank you, and thank you all for joining me. I'm just going to share the screen here. Okay, share it. Okay. So what I'm going to do in the next 20 minutes is a very quick overview of what I think we can say about food insecurity in the context of COVID. And it's a very quick overview, so bear with me. In case you're not that familiar with this construct, the operational definition of it in contexts like ours is inadequate or insecure access to food due to financial constraints. It's been measured for several years now in Canada using a fairly elaborate scale of severity called the Household Food Security Survey Module. This module was developed by the United States Department of Agriculture, and it's a very sophisticated tool. It has been running since 2005 on the Canadian Community Health Survey, and that's the backbone for monitoring food insecurity in Canada. A few points to flag for you here. The survey is very large, 130,000 people over a 2-year cycle, but it excludes people living on First Nations reserves. So it means that anything we get out of the Canadian Community Health Survey probably underestimates the problem of food insecurity. The other thing to flag for you is this little line at the bottom. Food insecurity measurement, well, the Canadian Community Health Survey as a whole was suspended in March. So we basically turned the lights off on this problem from that window. Here's what we knew before COVID. Our most recent data came from the 2017-18 Canadian Community Health Survey. 1.8 million households, 12.7% of the household population. At the bottom, you can see the breakdown in terms of severity based on the number of affirmatives to that 18-item module. And that 12.7% or 1.8 million households translates into 4.4 million individuals, including 1.2 million children under the age of 18. So before COVID, this was a big problem, and it was a serious problem. The main predictors of food insecurity are if someone is a working-aged adult, that they have children, primarily that they have inadequate or insecure income, and a lack of assets, most typically identified on the Canadian Community Health Survey and other population surveys by whether or not they rent or own their home. Also, food insecurity is racialized. Much higher rates of food insecurity are amongst Indigenous and Black Canadians, and that's true even after we adjust for sociodemographic factors. The other primary risk factor for food insecurity in Canada, independent of everything on this list, is living in Nunavut, where there are extremely high rates. Just to amplify a little bit on that, here's what the breakdown looked like for households with and without children in that 2017-18 Canadian Community Health Survey. So a markedly higher prevalence amongst families with children. Even higher if we look at lone parent families, where 1/3 of those were food insecure in 2017-18. Looking at main source of income, and you can see where I'm going here, I'm sure. Before COVID, what we knew is that to be a working-aged adult reliant on either employment insurance or social assistance was to be at a very, very high risk of food insecurity. And the only public income support program that is associated with low risk is seniors' incomes, but someone on EI or workers' compensation or social assistance is in trouble, right? When we look at the breakdown of who is food insecure by main source of income, while social assistance is associated with a very high risk, what you can see here is that about 2/3 of households, 65% of households who are food insecure or were food insecure pre-COVID were reliant on employment incomes. Who are they? Well, they're who you'd imagine. People in low-wage employment, precarious work, short-term part-time work. Also, we can again see the racialized aspect of this problem with Aboriginal and Black respondents identified as at much higher risk of food insecurity. Okay, so that's pre-COVID. We've had one population level measurement of food insecurity since COVID broke out, and that happened in early May. It was on this thing called the Canadian Perspective Survey, which is a subset of the labor force survey. There were 4,600 people surveyed from the 10 provinces. The measurement of food insecurity on that survey was a 6-item short form, 6 questions that are from the 18-item module that's running on the Canadian Community Health Survey and other population measures. What we know about the Canadian Perspective Survey is that it systematically underrepresents people who are renters, people who are divorced, widowed, or separated, and those employed in jobs that are not conducive to working from home. So the setup from the get-go was that this survey would underestimate food insecurity. Okay, here's what it looks like. The responses are broken down by children, people living in households with children versus those without. And when I say children, I'm talking about people under the age of 18. And you can see here the 6 questions that were asked and the percentage of respondents in each of those household types saying yes to those questions, and then the total number that are affirmative, any affirmative on the 6 questions. I should flag here that in this survey, they were asking about food insecurity experiences over the prior 30 days. We typically measure this thing over the last 12 months, but in order to capture the experience during the pandemic, they asked about the last 30 days. What you can see is 19% of people living in households with a child under the age of 18 and 12% of those without children under 18 were reporting at least one of these experiences, suggesting that they were food insecure over that last 30 days. How does it compare to what we knew before? Well, if we take just those 6 items and we do our best to match the samples between the Canadian Perspectives Survey and the Canadian Community Health Survey, here you see the results. 10.9% reporting one of those experiences at least over the past 12 months as opposed to 14.6 in the past 30 days. So while there are a lot of differences between these 2 survey activities, there is no argument here that the problem of food insecurity has gotten substantially worse. As you would probably also expect, the worse is associated with disruptions to the labor force. Among those who responded to this Canadian Perspective survey, the people who were worst off were those who in the prior week had been absent from work because of some disruption related to COVID. And here you can see 28.4% as opposed to 10% of people who are still able to work through the pandemic. So we've got a story of worsening food insecurity in the context of disruptions in the labor market, because food insecurity has primarily affected working-aged adults, and many of them were in the workforce. We don't know anything about the effect of food insecurity on health as it relates to COVID-19, but we know a lot about food insecurity in relationship to morbidity and mortality pre-COVID. And what I'm showing you on this slide is just a laundry list of what had been documented in Canada. People in households identified as food insecure are way, way, way more likely to report a whole range of chronic conditions, including asthma, arthritis, respiratory diseases, cardiovascular disease, diabetes, you name it. They're also much, much, much more likely to suffer from mental health problems. And whatever problems they do have, they're less able to manage. So they're more likely to turn up in hospital and to burn up more in terms of healthcare dollars. From the perspective of mortality, we know that to be food insecure is to die sooner. And severe food insecurity in particular is associated with higher rates of mortality across all causes that have been identified, at least in the Canadian Vital Statistics records, with the exception of cancer. Interestingly, while the majority of people, whether they're food insecure or not, die from major chronic conditions, the strongest associations between food insecurity and mortality are the strongest differentials, I should say, between food insecurity and mortality are identified for infectious diseases and suicides and unintentional injuries. So what can I say? We've got a population who are more vulnerable to a whole range of chronic conditions that are associated with higher rates of infection and more severe infection with COVID-19. And prior to COVID, they were more likely to turn up as dying from infectious diseases. So I think is just a matter of time until we start to see data showing the association between food insecurity and worse outcomes in terms of morbidity and mortality with COVID-19. But at this stage, I'm not aware that we have any data. What have been the responses to to COVID-19 that would be of relevance to us? Well, the primary response that I think is relevant to this particular problem of food insecurity is the Canada Emergency Response Benefit. But also the federal government through this pandemic announced first a one-time boost to the Canada Child Benefit and GST credit, and then a small increment to the Canada Child Benefit was introduced yesterday that is going to carry us through the rest of this year. If you look at the Canada's COVID-19 economic response plan, there's a much, much bigger list than I'm showing you here. I picked out these ones because these are income supports that would go to people who are extremely vulnerable to food insecurity. But I remind you that those findings about the 14.6% of people that were food insecure through that most recent survey, that's happened in the context of CERB. So this stuff is not insulating a fairly substantial number of Canadians from food insecurity right now. What we've also seen are some unprecedented announcements of funding for food banks and other food charity programs. First, $100 million announced at the end of April, and then shortly after that, this thing called the Surplus Food Rescue Program, kind of a combination of money for the use of agricultural commodities or processed foods that were not being able to be sold, but funneling them into food charity distribution systems. This is unprecedented. Well, we've had food banks in Canada for more than 30 years. We've never seen federal money go on the table like this for those efforts. Okay, what does that mean? Well, what we knew about the relationship between food banks and food insecurity before COVID was rather perplexing. Most people who are food insecure don't use food banks. And these little purple cylinders I'm showing you are data from 2017 and 18. The disconnect is profound. Food bank usage, while on the surface it looks like our primary response to food insecurity, it's a strategy of last resort, most often used by people who are severely food insecure. But even most of them don't go to food banks. What else do we know? We've had up till now no evidence that food insecurity or that food bank usage is protective against food insecurity, or that if somebody uses a food bank, their food insecurity will be resolved. So not a good story here. What we can see, and I'm showing you here a graph of household expenditures broken down by household food security status based on an older survey of household spending. Food insecurity denotes pervasive material deprivation. Households that are food insecure spend less on everything. And I'm going to show you with my mouse. This little red bar here, whoops. This little red bar here is the differential in terms of spending on food. But what you can see is that they're spending less on housing, they're spending less on other essentials, they're spending less on everything. So to focus on the food aspect of food insecurity is a mistake. Because what we're really picking up with food insecurity is a household that's struggling to make ends meet across a broad spectrum. Competition here from the household cat. Okay, what else? To amplify that a bit more, households that are food insecure lack more than food. And I'm giving you one illustration here from some work that we published last year, looking at cost-related non-adherence to prescription medications, which was a popular theme in Canada, a popular focus of policy discussion through this last federal election. And not surprisingly, something that's very much intertwined with food insecurity. Almost half of working-aged adults who report cost-related non-adherence to prescription medications are food insecure. So the idea, yes, we find people who are struggling through the lens of food, but actually as we scratch the surface, they're missing a bunch of things. What would it look like to make evidence-based policy to address food insecurity now? Well, through the years food insecurity has been monitored in Canada, we actually have a lot of information about policy interventions that move the lever on this problem. And what are they? They're, without exception, income-based interventions that are providing more secure, more adequate income to people who are low income. And here's a laundry list of those findings now. So my bottom line here, Food insecurity appears to have gotten a whole lot worse through COVID. Anything we know about health in relationship to food insecurity would suggest these people are going to be disproportionately impacted by the disease itself, but also by the economic fallout. Going forward, we badly need some policy intervention that actually gets at the underpinnings of the problem. Okay, I'm going to stop sharing there, and I will be interested in your comments and questions.
Thank you so much. If you have questions or comments, please write them now in the chat box. But thank you so much for sharing all of that valuable information. It was not surprising, but it was also difficult to hear, frankly, for myself. And yes, Blake agrees and says that was a great presentation. Very important information.
Well, thank you, Blake.
Thank you, I'm sure share the comments. Can you comment on access to food during COVID-19 because there were so many shortages?
Well, I mean, we've seen a lot of reports of shortages. I think the more important thing that is happening with food in general through COVID-19 is that we're seeing increases in prices. And from a food insecurity perspective, I think that's much more significant. I mean, the way that food insecurity is measured in Canada and the way that I've defined it throughout this presentation is people who are unable to afford enough food or the kinds of food that they want because of financial constraints. So we can expect the increases in food costs to take a bigger toll perhaps on those people. But the issues of perturbation in supply, I think those are it's primarily the cost that is going to play out in relationship to this problem.
Yeah, that makes a lot of sense. Marmy says, I thought I had read that single unattached individuals were also faring poorly, but your research doesn't seem to bear this out. Do you have any comment on that?
No, I think it does actually. I mean, I didn't show you an illustration of that, but a single unattached individual who is working age absolutely is at high risk of food insecurity. If they're if they have a low income. What we can see from looking at population data is that having 2 adults in a household helps to lessen the risk of food insecurity, presumably because it means there are 2 people with the opportunity to garner income or some kind of benefit. So just as the lone parent household, particularly the female-led lone parent household, is at elevated risk, this single individual would also be at elevated risk. How they fare going forward now depends on how their income sources have been disrupted through this pandemic, but also how well they're insulated from inflationary pressures associated with changes in the cost of living right now.
Yeah, thank you. So comment on the COVID research grassroots responses to the pandemic in radicalized low-income neighborhoods suggests that one of the key foci of mobilizations in mutual aid have to do with addressing food insecurity. Racialized, not radicalized.
Okay.
Keep reading down. I was reading the question. I was like, whoa, racialized. Pardon me. Yes.
So you need to help me with the question there, though, Kimberly.
Yes.
There's a lot going on in that sentence.
Sorry, it's not a question so much as a comment. Just supporting what you're saying, Val. That in our COVID research, which is just getting underway, and our focus is on grassroots responses to the pandemic in low-income and racialized neighborhoods in Toronto, what we seem to be seeing already is that a lot of the mutual aid work that's happening at the grassroots level is around addressing food insecurity that's falling between the cracks of formal response systems. So it really supports what you've presented today.
Yeah, it's interesting because this is also a time when we're hugely conscious of issues of race in Canada, and this problem goes hand in glove with other kind of symptoms and signals of systemic racism in Canada. Yeah. Thank you for that comment, Blake. Good.
Thank you, Blake. Sarah Gallagher says, is there an effective way to support food insecure individuals in our communities since food banks are not getting at the problem?
I think the way to support food insecure individuals is to ensure that they have adequate incomes. I mean, we have spent a lot of time in Canada trying to look for ways that communities can solve this problem primarily through food delivery mechanisms, food charity or community food hubs or collective kitchens or what have you. But at the end of the day, what protects people from food insecurity is the ability to go to the store or to order online and have their food brought to them. And there's just no substitute for that. The reason I introduced my little slide at the end about cost-related non-adherence to prescription medications is just to say, like, even if you were to give somebody who was food insecure some free food, they'd still have other very, very important needs in their life that they weren't able to afford to meet. And all of that stuff conspires to create those health outcomes that I was showing you. So, you know, we are a bit naive to think that we can fix this thing with food. The only evidence that anybody has been able to generate that shows actual changes in household food insecurity status or where we get into the root cause of that problem, which is to ensure that people have adequate income. And, you know, CERB, as great as it is on many fronts, you know, nobody did the arithmetic to make sure that if somebody got on CERB, they would have enough money to make ends meet, and that people who needed money to make ends meet through this pandemic would be able to get on CERB. And I think, you know, as we move forward with it being clear that this economic downturn is going to last for a while, we badly need to see the implementation of more effective income supports for people on the bottom end.
Yeah, that's.
Yeah. Yes, I just noticed a note here from Blake. Yes, absolutely. I think this issue is front and center in the conversation about a guaranteed annual income. You know, the reason that food insecurity rates are so high through that last survey by Stats Canada has to be about cracks in the safety net. And, you know, there's one way to fix that, and that's not to piecemeal, but to put a floor in. And that's what the argument for a guaranteed annual income is. Yeah. Kimberly, I'm all over the place here. I know you've got.
No, I think that's wonderful. Brian asks, how does the research represent Indigenous and remote communities specifically?
Well, the Canadian Community Health Survey captures people who are Indigenous but not living on reserves. And so it's through that lens that we have data showing these very, very high rates of food insecurity amongst Indigenous people. There are other surveys that I didn't show you data on that are focused, the Aboriginal People Survey in particular, that focuses on people living on First Nations communities. And that also reveals very, very high rates of food insecurity. In terms of remote northern communities, I mean, Nunavut, probably our best example of that, but also some other northern remote communities are included in the Canadian Community Health Survey. So, you know, I'm sure that the coverage is not perfect, but it's not terrible. And with the Aboriginal People Survey, we've got a survey that is a very, I think, robust assessment of food insecurity on First Nations. What I don't know is that there have been any more recent surveys of food insecurity in those communities since COVID-19. I suspect not. I'm not aware of anything. But I mean, in tandem with this very large monitoring system of the Canadian Community Health Survey, we do have the Aboriginal People Survey running.
That's great. Speaking of the remote areas, I was curious, Sameen asked, do you think that food availability is an issue in Canada, or is it access to food? And I think I would be curious specifically about some of those remote communities we were just talking about, because, you know, I live in Toronto and my access to food is certainly not hampered. Mm-hmm. Mm-hmm. But I don't know that that's true everywhere.
Well, I mean, there's no question. Living in downtown Toronto, we have access to more variety and more volume and more retail options than someone living in a remote community would. Does that matter from a food insecurity perspective? It's not so clear that it does. At the end of the day, what drives whether or not you say yes to any of these god-awful questions on these modules is the amount of money you've got in your purse. And so even when we look in Nunavut, for example, where the rate of food insecurity is very high, what can we see? I mean, the differential between food insecure and food secure, you know, one of those predictors is income. So you know, often people have tried to take this problem of food insecurity and step back and say, yes, 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 it's not just about income, you know, it's also about geographic access. But the truth is we have very, very little data to support that, except in extreme northern communities. But invariably, those communities are places that also have very, very high rates of poverty and unemployment. So, you know, I'm not convinced. Yes, we can find differences in food availability geographically, and they probably have some influence on people's dietary behaviors. But from a food insecurity perspective, I would come back to the argument that the bottom line here is money.
It often leads back to money. Michael Widener asks, how have distribution centers such as Daily Bread adapted with self-isolation measures since we last spoke about this? I assume this is an ongoing conversation for you.
Well, you know, it's interesting that you should ask that. Daily Bread Food Bank is preparing to release a report in the coming days, and they did a survey through this pandemic of their clientele. And so we're going to see finally, and I think very importantly, we're going to see sort of an extensive analysis of what's been going on there. I think that many organizations across this country have had to adapt to alternative modes of distribution because their old ways of working with volunteers, often elderly volunteers in community spaces, you know, fell apart once we started to have these shutdowns. So in Toronto, for example, public libraries have become a site for the distribution of food in some areas. There have also been mobile distribution units set up. So, you know, food banks, I think, across the country have been challenged to be quite ingenious about distributing. And as you're going to see in the Daily Bread report, they're also reporting that they're distributing more food now. And from my reading, at least of the public documents from other food banks, that seems to be true across the country. The other thing that's interesting is the disruption in the supply chain for them has meant that they've had to turn to more purchased food. So, you know, public monies, like that federal money, but also money from the provincial governments, has been used to purchase food and prepare kind of hampers that have been distributed. But my point in my slide about, you know, we don't have any evidence that it's enough to render people food secure. That point will not be contradicted when you see the report from Daily Bread coming forward. I mean, people are in rough shape who are using those agencies, but it's very clear when you scratch the surface that their needs go way beyond whatever that prepared hamper is that somebody has, you know, gone through hell and high water to assemble and distribute.
Yeah. Speaking of hampers, we have time for just one last question. Do you have any suggestions on interim steps from charitable food hamper approaches to income generating opportunities? For example, agencies wanting to help be better off paying people for honoraria for volunteering. What could be done over the course of a year to shift them away from hampers, or just giving out gift cards? Like, is there something that's a more effective tool?
I can't say often enough that what is the most effective tool is to put money in people's pockets. And that means, I mean, even the money that's been allocated by the federal government for the surplus food program and the, you know, $100 million or whatever, what we so badly need is people to have incomes. So, you know, if somebody's running an agency, employ people. Make sure that they get honorariums for anything they do, anything you can do. I mean, the slide I showed at the end where I was listing policy interventions that had showed an impact on food insecurity. I mean, one of them is the universal child care benefit that was introduced under the Harper regime. It was $100 more a month. And it was enough to show a significant drop in severe food insecurity. Like, that's very, very important. So, you know, even $100 is a lot of money for someone who is in this situation. So I would say that it's so important that people who are working as community service agencies or whatever on the front lines, you know, interfacing with people that are low income and struggling to make ends meet, anything you can do to increase the employment of those people, to increase their incomes is critical. And never underestimate that. You know, if you employ somebody, I guarantee you that we'd be able to come along and show an impact on their food insecurity. Take that same resource and spread it over a bunch of hampers that get delivered by volunteers and distributed. No, we won't show any impact. What matters is money and secure income, especially, and that means, you know, that means a guaranteed income or a guaranteed stipend of some sort. So, you know, community agencies really need to figure out how they can become part of the solution, with ensuring that the people that they're helping get money, as opposed to, you know, maintaining this charity model that is not effective.
I feel like I should applaud because that was a great speech. Thank you so much for your time. Thank you so much.
Thank you for the opportunity to speak on this topic.
This was fantastic. I hope lots of people watch it. Thank you so much.
Me too. Thanks very much. I appreciate people checking in today. Thank you.